Hi, I'm Steve Adubato. Welcome once again to a half-hour program dealing with important policy issues and issues like childcare. And to kick it off, we have Natalie Renew, who is a director of a national organization called Homegrown, focused on improving the quality and access to home-based childcare. Natalie, talk to us. First of all, welcome. Second of all, why is this more important now more than ever before?
Thanks, Steve. It's great to be with you. Childcare has always been an important issue in this country, but now more than ever, the pandemic really laid bare how critical childcare is to ensuring that we have a thriving economy where women fully participate in work, but also ensuring that children are cared for and supported during this challenging and difficult time. Childcare is critical for children who need to be out of the home. Quality childcare is critical so that children are learning and thriving and enter school ready to be successful. And it's critical for their families so that they can work and know that their kids are well cared for. And it's critical for communities and economies to ensure that parents are working and that childcare owners and providers are able to offer services that are valued and supported.
Natalie, you know this is part of our ongoing series called Reimagine Childcare. The website is up right now. We encourage people to find out more. And people think, oh, you're doing a series on childcare. This affects the economy. It affects the stress on parents, disproportionately women, single women, especially. But my question is this: to what degree has COVID adversely impacted home-based childcare?
Sure. So home-based childcare providers have experienced a number of things during COVID. Firstly, there's been increased demand and reliance on home-based childcare as center and school-based care shut down. More and more families looked to home-based providers, including relatives and neighbors, to care for their young children. Simultaneously, home-based childcare providers have really experienced enormous hardship during the pandemic. In addition to sort of worry about their own health, bringing, the children of essential workers into their own homes, exposing themselves to the virus. They also have experienced significant financial hardship, really a triple whammy of financial hardships, which is one, the cost of care has gone up. Sanitizing, buying PPEs and things like that have increased the cost of doing business. They have had disrupted revenue, either because enrollment has changed or because parents' ability to pay has changed. And for home-based providers, they have really struggled to access public supports, whether that is the Paycheck Protection Program or other state and federal supports. So it has been really very challenging for them from an economic perspective. And despite that, these incredible women and caregivers have continued to really support families through this challenging time.
Natalie, the series that we're doing is called, in fact, Reimagine Childcare. You have told our producers, and you've said publicly, quote, our current childcare system is simply not working. So, reimagining childcare, we want it to be way more than a slogan. If you reimagine it to what it needs to be, what it must be, what does it look like?
Well, firstly, it's got significantly more public support. We really need to think about childcare as a public good and one that we as communities broadly value and pay for. But also, I think there's a real opportunity to think about childcare that meets different parents and diverse families in different places and offers much more flexibility and really supports different choices that parents make. And so, what we hear from home-based childcare providers is that they want to be respected and valued as a critical part of the childcare system. And that, from the perspective of families, their needs change. When a child is a baby, they may want something that's different than when their child is a 4-year-old. And we really need to ensure that there is availability and supply of high quality options in homes, in schools, in community centers, and other forms of childcare. So reimagining childcare for me, number one, starts with significantly greater public investment that is really targeted towards improving compensation and working conditions for providers and caregivers. And it also really means getting more support to families, not only in terms of lowering the cost of accessing care, but ensuring that they have high quality options in different settings, including home-based settings.
By the way, have we been putting up the website of Homegrown? I want to make sure that we do, even if not now, we're in post-production, let's put it in there. Before I let you go, Natalie, it sounds like it's not just professional for you and not just because you're the director of Homegrown. It sounds personal for you. Is it?
Absolutely. I really feel so incredibly honored and privileged to get to work with hundreds of home-based childcare providers across the country. And these women are incredibly inspiring. They not only care for young children in their homes, but they are pillars and anchors of their communities. And I feel very lucky to stand beside them and support them in this work.
And finally, support for Homegrown comes from philanthropic organizations, foundations, et cetera. Same with us as a public broadcasting affiliate, a not-for-profit production company. Same thing with you?
That's correct. Homegrown is supported by 15 national philanthropic organizations who really came together around the fact that 7 million children under the age of 5 have their early childhood experiences in home-based settings, and that setting receives the least attention, investment, research, innovation, and we're really committed to changing that.
And that includes the Terrell Fund right here in New Jersey, in Montclair, New Jersey. Natalie, thank you so much. We wish you all the best. We will continue this conversation. The Reimagining Childcare Initiative is not a program, a series. It's an ongoing commitment. And Natalie, you're a part of our public awareness effort. Thank you so much.
Thank you, Steve.
I'm Steve Adubato. Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Terrell Fund, supporting Reimagine Childcare, Rutgers University, Newark, the Fidelco Group, Bank of America, RWJ Barnabas Health, Johnson & Johnson, the Northward Center, United Airlines, and by the Adler Aphasia Center. Promotional support provided by AM 970 The Answer, and by NorthJersey.com and Local IQ, part of the USA Today network.
Hi, I'm Abby. You might see me as an ordinary person, but I've been living with a brain injury since 2018. Opportunity Project gave me hope, and I've gained confidence through job skill training and helping my family. Despite my challenges with memory, I see a possibility to keep improving.
If you have a brain injury, you don't have to face your road to recovery alone. Learn more about Opportunity Project and its partnership with Children's Specialized Hospital.